So for this appointment, it's going to be the delivery of the sleep appliance as well as providing the patient the morning occlusal guard, also known as a deprogrammer. So once you get the device, what you want to show the patient is which one is the top, the maxillary, and which one is the mandibular. A lot of times when I tell patients about the device, the top teeth are relatively larger compared to the bottom teeth. So that way they can understand the articulation relationship. When you show the patient, you always insert the device, the maxillary first. That way the mandible can position itself in that protrusive manner, and then they will close in together. When you have them bite, you want to ask them, how does it feel? Do you feel any areas that are aggressively tight? Keep in mind, this is a customized device. It should feel tight throughout the whole piece. Is there any areas that are sharp, poking you? When they point it out, you go ahead and polish it, make those adjustments as necessary. When you insert, you also want to show them how to take it off. So the way you take it off when it's inside the mouth is you go from the most posterior aspect and then you kind of catch the side and you shift it down. Always the reverse. When you take it off, you take off the bottom first, then the top. Once you've shown the patient, you have them hold a mirror, they can look at it, you give it to them. You make sure that they can take it off and on before they leave for the day. Once you've established that, the next step is explain to them what the deprogrammer is. So here's our device. Once again, you want to show the patient. You want to tell them this is where their front teeth, top teeth are. This is where the bottom teeth are. So that way they can visualize it. A lot of times I tell them their top 2 teeth are the size of their bottom 4 teeth. Once they see that, you go ahead and show them. When you insert it, you want to be able to, if they have, let's say, a small mouth, you want to kind of swing it. Go insert here and then swing it so that way the cheek doesn't provide any resistance, and then insert. Once you insert there, you have the patient slowly close, move their jaw forward, and that's how they articulate the bite. And then, like I said, same thing, opposite way. When you take it off, you go from the most posterior aspect, you shimmy it out, and then you shimmy it from the top. Sometimes patients, if they open their mouth real wide, the bottom will pop off on its own, and that's a good way of kind of checking the fit.